Okay, let's talk about intra-follicular grafting. That means grafting in between existing hair follicles or existing hairs. Now, why do we do this? Well, a lot of people will have thinning across their scalp where they actually have hairs present, but they actually want greater density. And a lot of times they're told we can't fit a hair into where your hairs are, and therefore you can't have a hair transplantation. Well, if you do intra-follicular grafting, you can have a hair transplantation. You can increase the density. We have some great examples. Actually, some like the coolest results that you can't tell on picture, but are making patients the happiest are because intra-follicular grafting. Now, other reasons you want intra-follicular grafting is usually behind the area of hairline recession, there's an area of thin hairs that's going to recede pretty soon. Maybe with the next couple of years, maybe a little bit prolonged if you do good with maintenance therapies, but at risk during your hair transplantation, we have the ability to put hairs within those hairs, between the hairs, to increase the longevity of your result or carry the new density back further, allowing us to create more future-proofing is what we call it. Lastly, you'll see sometimes when you walk around someone who's had a hair transplant in the front hairline that they'll have this big bulk in the front, but then things will get really thin back here and the crown will be nothing. Well, in those cases, it allows us to create a much more natural foundation to the hair restoration. We're not just doing the hairline and leading the area that's thin that can't be grafted behind it. It allows us to actually graft further back, all the way back to the crown, such that when someone walks around you, they see a hairline to crown restoration that looks much more natural in shape and doesn't throw off someone when they're looking at you or speaking to you. That's something abnormal of happening on your scalp. We don't want that. Intra-follicular grafting before was not possible because the cores you're making were these big circles. You couldn't fit these between the hairs, right? It just was too big. You can actually knock out a follicle theoretically or transect a hair, and people are doing it. This is especially true with the DHI devices where the actual device carried the graft in it, meaning that it was pretty large to get in between those hairs. But now using an SP88, SP89 blade, these nice little slits, we can make right between the hairs, place the hair in there using more delicate, precise techniques from experience. We can actually graft within these hairs, increasing density in areas with thin hair, increasing longevity results, and laying down foundations of hair restoration that look much more natural over time than you could without this technique.